Portion of the presentation today is uh, Paul Goringer. So, Paul, did you want to do a quick introduction?
I can. I am Paul Geringer. I'm a faculty member in Ag and Resource Economics and do a lot of extension outreach on legal issues. So thank you all for joining us today.
Mhm. Now, Paul, I was going to hit record. Do we need to switch over because you might step out that I need to hit the record button instead of you, or will it still?
It will still record even if I leave and it will go to the cloud.
All right. Sounds good. We're going to start with asking you to complete a demographic survey. We need to collect information on the participants that attend our program. And so if I'm going to pop this up on the screen and then we'll start over with another introduction in case somebody else joined. But I did want to launch this poll, and if you could complete that, we'd appreciate it. And you should see it on your screen now. And like I said, if you could do that for us, we would really appreciate that. Um, just want to make sure everybody can see it because right now on my end, there we go. Yep, I'm seeing people complete it now. So we're good. Yeah. So like I said, if you could complete that a poll, uh, we would appreciate it. We're required with our funding sources to report this information. None of it is identifiable to you, but it is important for us in terms of reporting. And I'll give people a couple more minutes before I end that. Probably give us till 12:05. Well, just turn 12:05, 12:06, and then we'll get started with the material. Okay, it's not working on your phone. I understand that. I'm not sure why, but uh, that does happen. So that's okay. All right, I'm going to go ahead and end the poll and we will get started then. All right. So start with the introduction again. My name is Jesse Ketterman with University of Maryland Extension. I'm going to be your facilitator today. Our program workshop is health insurance options for farmers and small business owners. And so we're going to focus on the health insurance side today. And you should see my screen, my PowerPoint on the screen right now. Um, and this program was developed jointly with my colleague over at University of Delaware Cooperative Extension, and our project is supported by the Northeast Risk Management Education uh, organization. So, and of course, that's funneled through USDA and the National Institute of Food and Agriculture. And with all of our programs, we're required to show the Injustice for All posters. And so basically, they outline if you have a complaint that you want to file, you can do so by following the instructions on that posters. If you need more information on that, uh, please let me know. But as a recipient of federal funds, we do need to show these posters. And the same, our programs are open to everybody. And so you can see our a notice about that up there on the top left of our presentation. And I've already done the introduction, but there's my email if you need to get hold of me. I'll post that in the chat box at the end of the session as well. And so when we facilitate this program, we do have a survey that goes along with this program. It's probably going to ask you a couple of those demographic questions again, and I do apologize for that. But in the chat box, I put the link to this survey. And really, we want to know where you're at now in terms of can you apply knowledge and information to make a health insurance decision? Would you choose a health plan best for you in terms of your confidence? And how confident are you to understand how plans differ? If you want to scan the QR code, you could do that there. But the link I posted in the chat box as well. And just go until it says stop. And once it says stop, then we're going to ask these questions again at the end. And so you answer the questions now and you answer them at the end. And we hope that you learn something as you go along the way. So um, if you could do that, that would be great. And like I said, the link is in the chat box. And while you're finishing that up, I will kind of keep things moving. So what are we going to do today? We are going to learn about the important insurance options related to small businesses. And so we say small businesses and farmers because farmers are actually operating a small business. We want to talk about some things to consider when selecting an insurance plan. And we want you to know where you can go for information about health insurance options. So those are all important things. So we frame our presentation in terms of why. Why do I need to plan for healthcare? Answering a what question, what are my health insurance options, what resources provide that information, and a how question of how do I choose a plan. So those, by the end of the presentation today, we should be able to answer those 4 questions. And when you do that, you become a smart user of health insurance. And so, as you can see our logo up there, Smart Choice, Smart Use, this is part of a series of modules we have as part of our health insurance literacy initiative. So why do you need to plan for healthcare? And so uh, there's a couple reasons why you need to think about healthcare as you start thinking about succession planning, right? One, you need to make sure that you have the coverage you need to keep you well. We need to gain the most benefit from your insurance coverage, and we need to protect you financially from an unexpected health issue and know what types of options are available. And so, as we are aware, the older you get, the more health issues you experience. And so, making sure that you have the coverage you need to not only address those issues, but also have the coverage you need so it doesn't become a financial barrier for you when you're thinking about taking care of your health and your financial situation altogether. And of course, there are going to be out-of-pocket costs, and so you need to make sure that you have the money set aside for those out-of-pocket costs as well. So this is a starting point of where you need to look at what things you need to consider when you're thinking about health insurance. And so here, these are called the essential health benefits. And so when the Affordable Care Act was passed, it required insurance plans to include these 10 categories of services. Now, as we've evolved from the passage of the Affordable Care Act, there are now options that don't include all 10 of these services. But I share this because these are things that you want to think about and compare how they're covered in different plans. And so how is preventive and wellness services covered? How are lab tests covered? What are your hospitalization costs? What are your prescription drug costs? If you have services and devices, how is that cost? An example for me is I have diabetes, so I need to monitor my blood sugar level, right? So how is that covered? outpatient care, maternity and newborn care, mental and behavioral health treatment, pediatric care, and emergency room services. So again, I throw these on the screen because you want to think about how does the plan that I'm purchasing or how does the plan that I have cover the cost associated with these services? Now, we're going to look at what your health insurance options are, and then we're going to share resources with each of those options. And again, you become a smart user of health insurance. Now, there are factors out there that contribute to which health insurance plan you choose. And so the state you live in, so your health insurance options are going to be different depending upon the state in which you live in. And then not only the state, but where you live within the state may also have limitations on the plans that are offered. I'm up here in Allegheny County. It's a smaller county, not as many people. And so we may not have the same options as someone that's down in the Baltimore, Washington metropolitan area. Uh, and that kind of ties into the second point there, which is available health insurance policies and plans depending upon where you're at. Your income and your age are going to be variables, whether you have a disability, right? So the coverage you need based upon your disability may be important as well. How many family members, or if you're structuring it as a business, your business offering health insurance, how many employees you have. And so that ties into how do you have the business set up? Do you have it set up as a sole proprietorship, an LLC, an S corp? All those kind of change what options you may have available with insurance. And there may be, the last point there is you may consider multiple streams. And so when you're thinking about coverage, are there other things that you need to kind of add on to make sure that you have the coverage that you need? So these are some of the options that we're going to go through today. We're going to talk about employer-based health insurance and association membership. We're going to talk about the marketplace. We're going to talk about going to a broker or a dealer. We're going to touch on skinny plans and short-term plans, armed forces health insurance. So some of you may be veterans that have that option, Medicaid and what's known as CHIP, Children's Health Insurance Program. Christian health share plans or health sharing ministries, which is not health insurance, but is actually very similar to that, and Medicare. So that's what we're going to touch on today. So what is employer-based health insurance membership? Um, Basically, that is pulling together a group of people so that they can offer health insurance at a lower place. So usually it's ran either through an organization or a place of employment. So we know a lot of farmers will actually seek employment outside the farm just for health insurance. So that's the employment place. Uh, some organizations, and again, depends upon what organizations you may be involved in, they may offer health insurance options as well. And what are the benefits of employer-based health insurance and association membership? One, you have coverage. The plans can be usually less expensive than other alternatives, such as you seeking out insurance through a broker or dealer. So that pooling of people makes your health insurance usually less. You may be limited with the options. So you could have an employer who only offers one option, or you could have an employer that offers multiple options. The same with the association. They may only offer one option as well. Some things to think about when it comes to the health insurance piece. Check with the plan manager and see if family members are covered. So some employers may cover family members, some may not. The deductibles can be high, so you always got to think about deductibles. I always talk about the relationship between deductible and premium. Premium is that monthly payment you pay. Usually the higher deductible, the lower monthly premium, but when you start to use that insurance, you have to make sure that you have the money to cover the deductible. And then, you just want to make sure that the plan you look at covers all the care that you're going to need. And so where would you go for information about that? You would go to the employer's HR office or the health insurance provider, or if it's an organization, and they give two examples here, Farm Bureau and Nationwide, go to whoever the representative is within that particular organization. Now, the marketplace. Um, With the passage of the Affordable Care Act, they established both the nationwide marketplace, and then many states followed up and set up their own marketplace. So in Maryland, they do have Maryland Health Connection, which is the marketplace for Maryland. I do have Delaware over there, as well as Pennsylvania, Choose Health Delaware and Penny. And so those would be if you lived in Delaware, Pennsylvania. Um, the choices are determined by the state. They're easy to enroll. So again, you could go to healthcare.gov and it will take you to those statewide sites, or you could go specifically to the statewide site. Um, what is the benefit of the marketplace? Well, you get tax credits or you get a reduced premium for those making 400% of the poverty level or lower. There are tax credits to offset the premiums. There are usually a number of plans available so you can comparison shop, and this is one of those areas where deductibles will go back into the equation. Okay, you might want a lower monthly payment, but you want a higher deductible and vice versa. Um, you can find plans not just for you, but also family members, and there is an enrollment help. And so in my area, there's a group called AHEC West, and they are the assisters or navigators that will help you work through and answer the questions to select a plan. Um, what are some things to think about there or considerations? There are fewer plan choices than purchasing through a broker or an agent. If you make over 400% above the poverty level, it may be worth looking at what the options are with a broker or agent. And so where would you go for information? You can go to healthcare.gov, and there's a subsidy calculator to determine if you're eligible for the tax credits. Now you have Medicaid and, as I mentioned earlier, CHIP, Children's Health Insurance Program. Medicaid is going to be based on your income and family size, and it's going to have eligibility guidelines. Um, it's for non-long-term care needs. There is a different program that allows for that. Medicaid's long-term programmers for those who need continuous care or assisted living, and there's eligibility requirements that go along with that. And then you have the Children's Health Insurance Program, CHIP. It's for low-income families with children, generally under the age of 18, and it covers medical and dental costs. And eligibility may be different than Medicaid. So CHIP is going to have different requirements than Medicaid in some situations. Where do you find information? Again, you can work with that local navigator that I mentioned. You can go to Maryland Health Connection and they will work you through that. But there's another website, Medicaid and CHIP. You could just do a search for that as well. So this is an example showing you how the marketplace plan works. So we have two people here. They have a lawn and home clean out business. They have 4 children under the age of 18. All are non-smokers. Together they earn $106,000 a year. They live in Maryland. They are eligible for the advanced premium tax credit based upon the subsidy calculator, and I'm going to show you what that looks like here in a minute. They're at 253% of the poverty level. So the premiums would be $374 a month. The amount of the subsidy that they would receive is $4,346, and the total cost of insurance without the subsidy is $8,840. So you'd have to subtract out the amount of the subsidy there. Here's the Kellogg Foundation has an interactive subsidy calculator, and I'll show you how it looks when you punch the numbers in. And so here's your estimated financial help, $374 a month. And that's a tax credit. That's going to cover 51% of the monthly cost. Your cost for the silver plan is $362 a month. And the most you have to pay, 4%, 4.1% of your income. Without the financial assistance, you would be paying 737. So you can see a big difference between your cost and what the plan actually costs. Here's the second marketplace example. You have Sam and Sally, and they have four children, but their income's $47,000, and so they are eligible for Medicaid and CHIP. And so they're living at 100%, 109% of the poverty calculator. And so they would be eligible for Medicaid because of that, and they would then go to Medicaid for assistance. The next type of insurance that we are going to talk about is going to a broker or dealer. And so they would have plans available for you and your family members. They may also talk to you about Affordable Care Act plans. They may also be able to enroll you in those plans. They're going to have an agent who usually represents one company. If it's a broker, they may represent several. Um, but it's going to be specific to who they partner with, not all insurance companies as a whole. Um, in some cases, they're also going to be certified for the marketplace. And so, what are some things you need to think about if you go to a broker or a dealer? And an example, if I had to say, give you an example, is you walk into your local State Farm office and ask them what your health insurance options are, right? That would be going to a broker. What you'd want to do is check your state's health insurance commission to see which health insurance providers are licensed to sell in your state. And then when you do this, you are going to want to compare more than one broker. And so when you do that, you want to also understand things such as commissions, differences between plans, um, all those questions that you'd want to ask when you comparison shop. And there's the information. Again, you check with your state insurance commission and healthcare.gov. Another option there is if you're a veteran, you might be eligible for health insurance through the armed forces. So whether you're active or retired, um, you'd have to see what the eligibility criteria is based upon if you're retired, and if you're a disabled member, they cover at different percentages. That would all be through the Veterans Administration. And so if you search the Veterans Administrations, they would be able to provide you with additional information. And there's the site for TRICARE, which is the health insurance program that they provide. Now you get into Medicare, Medicare Advantage, Medicare Supplement, or Medigap insurance. And so now we're talking about you turn 65, what are your options? And then you start getting into this, well, you have this Part A, Part B, Part C, and Part D. And so again, it's an option for 65 or older and certain people with certain disabilities. When you're talking about those different parts, Part A is the hospital, going to the hospital part. Part B is your doctor visits. And then Part C is if you don't want to go with parts A and B, you can choose a different plan, Part C. And then you have Part D, which is the prescription. Now, when do you sign up? And so if we're looking at this from a retirement perspective, there's a 7-month window when you sign up for Medicare. It's 3 months before the date of your birthday, the month of your birthday, and 3 months following. That's when you have to sign up. If you don't sign up during that time, there can be a penalty you have to pay because you didn't sign up, right? Um, Now, if you're going to keep your health insurance through your employer because you're still working, then you'd work out with your employer as to which the best route to go there. But again, you must sign up during that 7 month window. And again, whether you're getting your Social Security or not, that's irrelevant. Keep your Social Security separate from Medicare when you're doing your planning. And most people say that Medicare is going to cover about 80% of the cost. So uh, then you need to think about, okay, where's this other 20% uh, coming from? And that's when you look at those supplemental or Medigap plans. Some resources there. Again, there's a Medicare website. It has its own website with all the information you need. And then you have employers based plans for retirees. So you'd have to check with the HR department there. Now, Christian healthcare plans and healthcare sharing ministries, what you're going to find is you'll hear about these on the radio. Right? And I'm not saying you should or should not use them, but you need to understand that it is not a health insurance plan. They facilitate a process. And so what they do is use the system of pooling money and distributing it to reimburse cost. And you can see everything I just said there. They do have something that would be similar to a deductible. You do have a lot of flexibility in selecting your providers. In some cases, they may negotiate rates with those providers, or you can even negotiate the rate with the provider. You pay the bills and then you get reimbursed. And sometimes the different plans may have eligibility of requirements. So they may say no use of tobacco. They may say we're a Christian-based organization where plans are for Christians. Examples like that. So they're just check out what the eligibility may be. And then in some cases, there may be certain prescription drugs that they see as contrary to the beliefs of the organization, so they may not cover all prescriptions. So these are things to all be aware of when you're thinking about, okay, I'm going to go down the route of uh, health sharing ministries. Then, as things progressed over the years with after the passage of the Affordable Care Act, they wanted to create a way to offer some short-term plans that doesn't have all the bells and whistles of the plans that the marketplace plans had. And so because of that, because they're intended to be short-term, they can be less expensive because they don't provide the comprehensive services. Um, they do have the ability to deny pre-existing conditions, and there may be limits to how much is paid out a year. And this is the way I would say this, right? These plans are designed not to provide you with insurance coverage, but to fill in a gap until you can get back to a regular insurance plan that covers all those essential health benefits we talked about earlier. Yeah, and here's a good term here. It talks about it's a short-term safety net, right? So it's something is better than nothing, but it's not uh, the best option for you. And then you have to see what your local uh, what Maryland offers in terms of short-term plans. Now, let's say you want to think about providing health insurance for others in your farm operation. How would you do that? So there's three options I'm going to touch on here. There's the SHOP program, which is the Small Business Health Insurance Options Program, health reimbursement arrangements, and just paying people extra and they can go out and get their own insurance. So those are the three options. When you talk about shop is essentially the marketplace for small businesses. So it's the same as the marketplace. It's just designed for small businesses. Um, you see there's a limit on the number of employees. You still may be able to offer tax credit, but it does allow you to offer something. And one of the things that they require here is that what you're offering to one category of employee, what you offer to one in a category of employees, you need to offer to everybody in that particular category. So anybody that's doing similar work, they would be getting the same type of insurance. You can't say, well, this person's been here 20 years. I'm going to offer them insurance, but the other person's only been here a year. I'm not going to offer it to them, but they're doing the same work. They're saying their title is the same. You could also work with an agent to get something for your business, and they would kind of work with you and figure out what would be your best for the information you share, the size of your organization, those kind of things. And anytime again you work with an independent agent or broker, you want to shop around and get a couple different quotes. Another way to help your employees is to create a health reimbursement account. So it is considered a benefit to employees if they want to purchase health insurance. It helps offset the cost. There's a tax advantage to that. It's set up by the employer. It is funded 100% by the employer, and the funds pay for medical expenses until the amount of money is exhausted. So if you said I'm putting $5,000 a year into this, once that 5,000 is spent, it's done. They wouldn't say, well, I need more money now. It can be used for premiums, deductibles, co-payments, co-insurance, and other qualified expenses as determined by the IRS. Um, Contributions are tax deductible by the employer. Like that goes back to there's rules about, again, making sure that if you offer to one, it's offered to everyone in that particular category. The other option you have is just pay someone a little higher wage and say you're on your own for health insurance. Um, the downside is if you offer additional money, you can't require them to purchase insurance with it. And there's the IRS publication 969 that kind of provides the guidelines for that. When you start talking about documents, some things, the evidence of coverage is what we call essentially the contract between you and the insurance company. It talks about how your interaction is between what is covered and what isn't covered, how you file disputes. It's just basically all the information about the plan. Now, if you're thinking about healthcare.gov, they have their own website, a wealth of information. Same with Medicare.gov and Medicare. If you every October 1st is when the information comes out for the plans for the following year. So how do you plan and how do you choose? Our team does have a workbook that helps people go through the process of selecting a plans. It has you think about how you intend to use insurance in the coming year. It talks about, asks you what doctors that you currently attend and are they covered by the plan that you're looking at. And so it helps you kind of work through some different pieces of information and then allows you at the end to compare three plans so that you can select the plan that best fits your particular situation. And as we get to the end, I'll pull up the website for us and some other resources as well. And now that we're there, I will do that. So let me pull up information about the website. So if I go to Health Insurance Literacy Initiative, University of Maryland. That our site should pop up. And so on our website, we have a list of consumer resources. And within those resources is the workbook that I mentioned. And so there's the Smart Choices Workbook, 8th edition. You click on that, and that should open up the workbook. Another important document to share there. These are all forms that you could print out. So how do you choose a doctor? Important terms, all of this information. How do you save money on prescription drugs? This is all information that's available on our consumer resources tab. We do have a publication specifically for farm operations and healthcare insurance options that was based on this presentation today. And so it kind of outlines everything that we discussed today, works you through the plans. There's the information about, factors that you need to consider, impacts of income, your business structure. And I'm going to put this one in the chat box because, again, this was really adapted from our presentation today, the state on which you live. And so it's a 15-page document, and it goes through everything that we talked about today. We do have a tab on our website that specifically goes into, as soon as I can get back to it, for farmers. And that publication is there, but some other additional resources that are available there. And it highlights the importance of health insurance within the agriculture community. So with that said, I want to go back to answering any questions. If you have a question, you can unmute or put it in the chat box. As we do that, I'm going to ask you to go back to that survey and open it up and click the next button and answer the questions, the same questions that you had at the beginning. You're going to ask again, and we're going to see if you moved up the scale. So hopefully you went from moderately confident to very confident or slightly to moderately. But if you could finish that survey, that would be helpful and give us an idea of how the program is working for us. And there's my contact information again. And feel free to reach out to me. I can send you that link or any of the links I mentioned earlier as well. And back to showing the Injustice for All poster. And we thank you for joining us. I'm going to stick around, answer any questions. And again, a big thanks to the sources that we have that help support this project, the Health Insurance Literacy Initiative, which includes University of Maryland Extension, through the College of Agriculture and Natural Resources, and University of Delaware, and my colleague from Delaware, Maria, who was the key in developing this particular presentation. And so back to questions. We didn't dive much into long-term care, and long-term care is a whole different discussion, but long-term care is different than health insurance. And like I said, if you had the survey, please pull that back up, fill out that survey. If you don't have any questions, you can feel free to step off. And it was a pleasure working with you today. Thank you. Doesn't look like there's any other questions, so I'm gonna wrap up the session. Thank you for joining.